Thank you. Good afternoon, everyone. Oops. Okay. My topic that I'm talking about is transitioning novice nurses or new graduates to the workplace. Now, to give you a little background, why is this important? Well, statistical by the American Nurses Association, it says that 1.1 million nurses are needed in the United States by 2020. And that is because 1/3 of our current population is retiring. And also 20% increase are going to new positions. So they are doing higher level education, advanced degrees. They're going into management, leadership, and also faculty positions. 34,200 more are post-secondary nursing instructors that are needed by 2022. What has happened is we've created a sandwich in that we have a nursing shortage of nurses to be able to go into the workforce, and we don't have enough people to teach them. So we are dealing with a crisis on both ends. Okay. One of the discussions always been is for the United States is what's the pros and cons of an associate degree versus a bachelor's degree. And the reason why I bring this up is that when I talk about the portion about the residencies and orientations, the nursing residencies are based on BSN or Bachelor's of Nursing curriculum, not associate degree curriculums. There are some slight changes, but they don't differ a lot except in cost and how long it takes the student to complete the program. Okay? So the problem is new nurses need to take care of sicker patients in complex health settings. Okay? Another problem is they feel increased stress levels. So what happens is they are thrown into, after being in nursing school, they are oriented to whatever their unit is after they've taken their state board exam. And they are required to time manage, critically think, and do everything in a reasonable time for 3, 4, 5 patients who a lot of times have more than one disease. That may not be the presenting problem at the time. However, they impact each other, okay? Another problem is these same new nurses, because of these issues, about 25% of them leave within their first year of practice. How does that impact it? Patient safety, because we are short-staffed. Also our healthcare outcomes, because we know that if we are better staffed with healthcare workers, then we have better outcomes. We have less rehospitalizations, we have less medication errors, and so forth. It also costs the organization at least $100,000 each new grad to replace them, because it is their salary that they have to replace plus the preceptor that they have assigned to that new nurse. Okay? What happens when new nurses have to take care of sicker patients in complex settings? 40% report making more medication errors. And medication errors can be defined as either missing one of the 5 rights or actually just giving it at the wrong time in this world of informatics. Again, the increase of stress also plays a factor on the patient's safety and practice. And then because of those things, then there's an increased turnover, okay? So this is a transition to practice model. I'm going to explain it to you briefly. This comes from the National Council of State Board of Nurses. This is an issue that was recognized back in 2011. And what was noticed is that we need to be able to, in a sense, bridge the practice requirements with what education, nursing education, we are giving our new nursing students. And they have actually developed this model. Now, it covers informatics, quality improvement, evidence-based practice, communication and teamwork, and also patient-centered care. Now, if you see from the triangle, the education is on the left, then practice is on the right, And then regulation is on the top, so regulation counts as the State Board of Nursing. Where we are not at yet is, even though this is a model, it is not a standardized requirement in all states. So organizations have the choice to offer something that falls into this model versus doing a regular orientation. Uh-oh, what just happened? Oh, sorry. There we go. Thank you. Okay. Oops. All right. Now, the two paradigms that we have with this is that one, the Institute of Medicine has asked by 2020 that we increase our nursing new graduates bachelor degree level. It needs to be the entry level of nursing. So one of the talks has been, how can we increase the academic progression so that nurses do not have to take such a long time for the bachelor degree completion? Because the thought is that they have better critical thinking knowledge, they know how to manage patients, and they can move on into leadership at a faster pace. But then the other problem is we have nursing residencies. It seems like my slide got moved somehow. Nursing residencies are an extension of nursing school, pretty much. There is didactic, and there's also simulation, and also they have a preceptor. Now it varies from 4 weeks to 8 weeks to 12 weeks to 16 weeks of training of either didactic, which is actually lectures and exams and so forth, and of course, working on the floor. Now, the thing with that is, again, it is not a standardized requirement. So in each state with a new nurse, it is not required for a nurse to go through that program. However, organizations who are family organizations, as far as have multiple hospitals, have invested millions of dollars into having these programs because the research says that the nurses will stay longer. So the goal is so that all 50 states would actually be able to adopt this in their regulation so that we can actually fix our nursing shortage that we are actually dealing with. Any questions? Yes.
Well, I think it's very expensive and very competitive too, because a lot of my nursing students will apply for these programs.
Yes.
And some of them get in, some of them don't, but it's because they're very, very selective, and they only pick a few new nurses, and that's it.
Right. Yes. And plus, because it's not, again, it's not a standardized regulation. They can choose their requirements. I have graduates and nurses, for example, and I'm from the state of Florida, so with our residencies that most of my grads go into, they must pass the NCLEX for the first time. They must have a certain GPA, which is usually almost a 4.0, which we all know is very challenging in nursing, you know. And they must have references and so forth and so on. And they go through about 4 interviews. And the residencies are not open more than twice a year. So if this is now June, so now I have a new batch of new graduates that are actually applying for residencies now. It's usually June and October. Yeah.
We have a copy of that model. That's your model, right?
No, this is a model from the National Council of State Boards of Nursing. If you go on the website, and I believe it's also in the reference of my abstract, if you go on the NCSBN website, there is a thing called Transition to Practice modules and toolkits. It is in there. Okay. Any other questions? Thank you.